Excellencies, colleagues, ladies and gentlemen. Imagine waking up in the morning, not feeling great about your health, worried about paying your bills, whether your house will be yours tomorrow, worried about safety in your neighborhood, and not having people you can trust and turn to for help. That's the reality of far too many people in our region. I salute the European Parliament for putting the issue of social health inequalities in the European Union on the agenda. And I'm so grateful to my dear friend, the chair of the European Parliament's Special Interest Group on Health Inequalities, Professor Vytenis Andriukaitis, for his tremendous commitment. The data is clear. Today, over 1 in 5 people in the EU experience poor health and insecure living and working conditions. Women and men in the lowest income groups are more likely to be living with an illness that limits their life compared to those better off. And women are worse off than men. Our new WHO European Health Equity Status Report will show new and worrying inequity trends in younger people reporting illness. Again, the statistics reflect societal gender inequality. Our findings show that social isolation and loneliness have negative health consequences. They can increase the risk of stroke by 30%, dementia by 50%, and premature deaths by 25%. Europe can no longer afford health and social losses of that scale, and particularly not when they are avoidable. I believe that by reducing inequalities, Europe can be healthier and stronger. 3 points worth raising. First of all, reducing inequities is vital to protect and support human and social capital. With a ratio of fewer than 2 young people for everyone over 65, in the coming decades we cannot afford for any young woman or man to be left out of education, employment and civic life. Investing in youth-responsive health services and social protection is a winning strategy for healthier societies and high levels of human and social capital. Second, when we reduce inequities, everyone benefits. The widening health and social gap is a danger to the stability of our societies. In Europe today, those struggling to thrive are 40% more likely to distrust others or authorities. We urgently need to renew our European Social Pact. And my third point, reducing health and social inequities is critical for fiscal stability. Equity is good for the economy. Investing in workplace well-being through decent working conditions, employment contracts and wages could add an estimated $11.7 trillion to global economic growth. A modest 0.1% increase in preventive health spending could boost annual consumption by people over 60 by 9%. This is significant, given that older people drive up to 50% of all consumer spending in the European Union. So let me close by stressing that breaking the intergenerational cycle of poor health and unequal opportunities requires action across the entire life course. Our Health Equity Status Report will show this with deep dives on inequities across the life course, with a clear gender lens. I warmly invite you to the report launch later this year so that we together can carry the momentum forward. Dear friends, working with Médecins Sans Frontières at the start of my own career reinforced my lifelong commitment to social justice. I witnessed firsthand that health inequity is wasteful, unjust, and avoidable. And today is no different. We still have a lot of work to do through partnerships as these and collaboration, because the health sector cannot reduce inequities alone. This silent epidemic cannot remain silent any longer. Thank you.